And the more you can start to define that circle of 8 with those specific patients you're dealing with, the better. I'll give you an example. If you have a product that's a genetic product, it's caused by genetics. The sibling, maybe, if you're able to get a sibling who's on your product and send them information to talk to the rest of their family, basically, you are now starting to connect with a group of patients rather than just one. So thinking of who are the different people in this disease. Another good example is a work colleague. We deal at Valio with hyperhidrosis, excessive sweating. Where do people see sweaters? People upstanding, oh, look at this. They got a great big, and that's where they see it, and they'll talk to each other about it. So, knowing what they do is absolutely critical to deciding what you do with these patients. In fact, the Shoppers Drug Mart Optimum program for OTC products does this. They do a thing called predictive modeling. So what they would do is they will look at the customer group that they have through Optimum on your product, but they go a step further. Rather than just sending a mailing to them, they will actually look at all of the different things they do. What do they buy? Kleenex? Do they do this? Do they do that? And then you can cast out your mailing to a broader group that all have all the same activities and behaviors in common. And that's a neat way to try and capture your group tighter, because you can't go to everybody, right? This works better for DTC, but it works for DTP as well. So how to involve healthcare professionals. There's a real neat example that I just wanted to share. I wasn't involved with it, but I've seen it work quite nicely, and it's the Crester example. It's called Crester Healthy Changes Support Program, and that was a compliance program. It's been hugely successful, but it's a good example how a DTP program actually became a real good part of the marketing mix with doctors, pharmacists, and patients. And their challenges they had was it's asymptomatic, so cholesterol, it's huge competitor Lipitor, and they had lots of U.S. ads with negative stuff. Solution was a web-based program, and the doctors delivered it, and the pharmacists gave it to the patients. And what was really interesting about this is they were actually able to get enough data out of that to get a PAB-approved claim that they could put on their ads back to doctors and pharmacists. 95% adherence to Crestor was demonstrated with Crestor Healthy Changes Support Program. Really neat way to use DTP to actually use their data to go back to doctors and say, look how well this drug works, and by the way, there's an added benefit. So it's a neat example of how you can actually go beyond just one little slice with DTP. So I thought that's a good one to look at. Messaging is key. Know your patients. Earlier we had the speaker who pretended to be David Rendamonte, and he was talking about understanding needs behavior of healthcare professionals. You need to actually know your patients the same way, understand their behavior. Conduct the research, do focus groups, do ad boards, read the chat rooms, meet with patient associations, they're all over. And then the other thing is meet with the suppliers. It amazes me how many marketers don't meet with suppliers. You don't know what you're doing, and you've got your one ad agency. I don't want to see anyone else. That's my ad agency. Man, you got web people out there. You've got PR agencies. They know what they've got examples all over the industry. If you're searching for it, meet with every one of them. Find the best one, but you'll learn all the way through. And you can't get better than that. So, I've been on both sides of the table, and let me tell you, there's a lot of knowledge on both sides of the table. The other thing is use what you do well on the side with healthcare professionals. We tend to develop a creative strategy, and we focus a lot on it. What's the benefits product of our product? What's the proof source? Who's the competitor? Who's the target audience? What's the tonality? Do the same thing, same rigor that you do with doctors, do it with patients if you're serious about a direct-to-patient program. Really, really use it, not only getting the data. Now, how do you apply it? Think it through and develop your strategy. Another thing to think about is the difference between the doctor's perception and the patient's perception of a disease. So the seriousness of the condition, is it life and death, or is it cosmetic? So there's a whole spectrum there, right? Where do you sit on that? Where does your product sit on that spectrum? That's got a big difference about how serious your patients will take the communication and how you communicate to them. Another one to think about is the quality of life interference. A lot of times you get a different perception between the doctor or the pharmacist and the patient. The doctor thinks, you know what, it's not, hyperhidrosis is another good example. Doctors say, patient's got sweating. You know what, they can get clinical strength or whatever. Some of these patients, to them, it's as bad as psoriasis. It's a horrible quality of life. They change their clothes 3 or 4 times a day. They can't shake hands with people at work. They're totally asocial. And yet the doctor says, it's a sweater. So, you know, it's a matter of bringing the doctors along to understand that, but it's also a matter of understanding the patients and not doing a doctor focus group to try and determine what the patients think. You got to do a patient focus group. Big difference. You got to think about that carefully. Cost of medication. Is it reimbursed or is it out of pocket? That doctor might say, you think my patients are going to spend this amount of money? Well, they might if it's that severe, but if the doctor doesn't take it that severely, not going to talk to the patient about it. So again, there might be a dichotomy of thinking. Maybe the patient will pay that kind of money for it, and the doctor doesn't think they will. Again, those things you need to think through very carefully. There can be a big dichotomy. Other points to consider. How to identify and leverage healthcare professionals who are also patients. You don't get a better, if you got a successful patient who's a doctor, how do you use them? Man, they're gold. Same with the pharmacist. You know, they can say anything to other patients and to consumers. You got it made there. How to identify and leverage celebrities who are on your product. You've seen some of these cases work extremely well. And then how to get your product on Oprah. Hey, you know what? That's the ultimate. If you can get your product on Oprah, you got get a patient who Oprah likes, and you got it made.